long road to open, first of all, open the new hospital. And we did that ceremonially on November 21st. We all came here with our patients. But along the way, we had a dream to expand the small, very small chemotherapy clinic we started 15 years ago. It was one chair and just half a room. And over the many years, Karen Bartlett had a vision that, you know, this should be a much larger program. So she and the team from London Regional Cancer Clinic had many discussions, and slowly we embedded it in the building and the plans of that new hospital, which we stand here today. And as the standards of the cancer program grew and grew, so did that clinic. What was acceptable 15 years ago no longer was in the new world. So the clinic is much, much larger. It's probably the size of the department now compared to what we had originally started out with. So we're very pleased that we could bring that on board along with the new hospital. It was also strategically placed right next to the pharmacy department where the drugs are put together and then of course delivered right across, and it's safe for patient care, and it's just in time as well. There are many, many people to thank. This was a complicated process. It was partnering at its best. It speaks to the respect that our staff have for the London Regional Cancer Clinic, the London Health Sciences Centre, and for the Thames Valley group of hospitals that we all belong to. We have mutual electronic patient records. We share staff along many different clinical lines. But this program really took a lot of partnering and a lot of intense work. There are many people to thank for that. I know we have a big team here from London Regional Cancer Clinic, and I'd like to mention some of the names and thank them. I know that Bonnie Adamson, the current president and CEO, really supports this program, and she really, in her vision of partnering and expanding the academic teaching center to the regions, this is something that she supports strongly, and we thank her for that. We thank Brenda Fleming, who worked on the minutiae of the program, Dr. Vanderberg, the oncologist, who also helped get the clinical program started, Harry Milne, who basically had many, many hats. I just asked him, were you the Blake or the Karen? And he said he does both. Of course, Neil Johnson, our Vice President of Cancer Care Ontario, and his predecessor, Brian Orr, who also helped us make sure that the paperwork was all signed off just before he left. On the Woodstock Hospital side, it was a program that also took a lot of effort. We're happy to see Karen Bartlett back here. It was her vision, it was her, she sort of kept the flame going on this program, so now she's replaced by Bruce Atkins, who's also passionate about it. Sylvia McLean, who implemented the minutiae, the details, the negotiating. It was fairly intense. We had agreements with both London and with Cancer Care Ontario and ourselves. And it's perhaps just as complicated as building a new hospital. We also have our pharmacists, Sue Lang and Fatima Vieira Corbella, who are our team leads and the director of pharmacy. We also have the Greater Pharmacy Department, who will be supporting this program. We also want to thank our donors for giving us the capital to build this program, and for the continuing capital acquisition that we'll have to make and buy this equipment as we move forward. It really is a program that will deliver every single day. Not only will we be saving time for our patients, but we'll be improving the carbon footprint. We're going to be saving over, at least, I think conservatively, 250,000 kilometers in travel time, and probably 4,000 to 6,000 hours of travel time that people don't have to drive in and out of London. It really is the best possible scenario. Once you get stabilized, you're on a program, you come here for world-class training. We also have two physicians who have come on board, Dr. Karen Fryer and Dr. Joe Brio, who will be supporting the program locally and will be training with the oncologists in London as well. And we thank them for that support, and our whole medical team for supporting the program of this complexity and size. We anticipate once it's open that it'll serve about 270 patients, about close to 3,000 visits a year, and that it will be in a very comfortable, safe environment, and most of all, it's close to home, and it's at the new hospital. So I would like to now bring